Group that I did a lot of work with, we call it disordered eating, sometimes referred to as eating disorders. Most of this population is unfortunately young women. These numbers aren't going down thanks to the way that you can digitally change photographs, you can change yourself. Children now have the ability to take 500 pictures of themselves. Until they get the one that makes them look exactly the way they want to, and then they can shape it, they can change the color, they can highlight things. So we're getting a very distorted image from the magazine covers. Men's Health, never had a subscription, don't think I ever will, it'll just make me feel bad, all right? I have my goals, I have my dreams, I know how I need to be healthy, and that's okay for me. But for those who are impressionable, it's very tough when society just keeps telling them that it's the Kardashians. That's who they should look like. Here's what everybody's wearing this summer. People magazine's 50 best whatevers, okay? This population here, obviously a lot of body image issues. So when we're working with them, I found that education is best. Because sometimes I'll be working on somebody, and because the skin is sort of literally hanging off of them, they say, oh, excuse me for my flab. Like, what? You're 80 pounds. What are you talking about? That's what I'm thinking in my head. But I have to give it to them and explain that as they're losing weight so fast, the skin and the fascia didn't get a chance to catch up. And as they're going to swing back, that's going to fill out again, and that's okay. One of the big exercises they give the eating disorders patients at the Homewood is they tell them to pick a body part that they really, really hate. What's bugging them the most? Is it their butt? Is it their legs? Is it their arms? And then they write a letter to that body part telling them how angry and disgusted they are at them, how horrible they look. Just let it all out. Just let it all out, let it all out. And then they have to read that letter out loud to the body part. So once they've done that, now they have to write from the body part's perspective back. So if it's a leg, now the leg says, well, you wouldn't be able to stand, you wouldn't be able to kick a soccer ball, you couldn't skip, you couldn't jump, you couldn't swim as well. You couldn't do all these things without me, you know? One of your first milestones in life was walking. Without me, that wouldn't have happened. So they get them to change the psychology, because unfortunately, disordered eating of all the mental health issues, as far as percentages go, has the highest mortality rate. And it kind of makes sense. If you're starving yourself, eventually your body system starts to break down. So again, a great group to reach out to. Any one of these groups that I'm talking about, it's a matter of a phone call. You just make a phone call or get on the internet and send a message to them, asking for some flyers. Reaching out in your community, letting them know that perhaps you suffered from some of these things, or you know somebody who did, and you would really like to help. Here's who I am, here's my resume, here's my website, here's the clinic I work at. I'd love to come and have a meeting with you, so maybe you would refer some people to me, because I think I can really help them out. Okay?